Okay, we are waiting for a few more, but we'll get started. Thank you very much for joining us today for our insurance roundtable discussion featuring our level self-funded chamber program. We're very excited to have this conversation with you so you can learn more about our program, but more importantly, ask questions about it. This is a different type of insurance product that we're offering, and we've got a powerful team here to lead you through this discussion. We have Tony Stratetis, who is the principal of SL Health Plans. He actually is the one who came to us along with Darlene Kish, who's the managing director of HILB Group. And then, of course, our very own Kelly Smith, vice president of NFP. They have all been instrumental in bringing this product to the Middlesex Chamber. So we're very excited about this. I'm going to turn it over now to Tony to go over a few short presentations. We're going to go through a few short case studies. We've got our very own chairman, Mr. Tom Byrne, who is going to be going through his own case study. He recently purchased the product. He's going to tell you a little bit about how he feels about it. If anybody has any questions at all, please, you can either use the chat function at the bottom or raise your hand, and I will call upon you to unmute and to ask your questions. We do encourage you to partake in conversation and ask questions. This is a great opportunity for you to learn more about this product. It can be some bit complicated. I will tell you, I've learned a lot through this process, and I do appreciate the expertise that we're going to see today. So without further ado, I'm going to turn this over to Tony. So here we go, Tony Stratetis.
Thank you, Johanna. Good afternoon, everyone. I'm honored to be involved in this and have a conversation with you and share with you the program that is being offered through the Middlesex Chamber Health Benefit Program. As a business owner, I'm sure like the rest of you, the second largest expenditure most of us have on our balance sheet is health insurance after our payroll. And if my experience is like yours, I rarely see those rates for groups typically tend to go down, particularly in the fully insured markets. And this is certainly an imperative conversation to have. And I would presume that the fact that you're actually taking some time out of the middle of your day to see this, that there's some value that will be added to you in this presentation. So we're going to talk a little bit about what is exactly level funding. Try to dispel maybe some of the misnomers that folks have on information they may have seen in the past. How does this particular program that Middlesex Chamber is offering differentiate itself from what you typically would be able to purchase or do purchase on the fully insured markets? Is this, and what value may this bring to your business, and is it right for you, and what companies is it not right for? And as Johanna stated, there are some case studies that we're going to be sharing with you with actual chamber members. Some have had just recently purchased these, gotten involved in this program. Others have been in it for a couple of years, and I believe we have one that's been in for nearly a decade. And then, of course, we'll have some Q&A. So I will start by giving you a high-level overview of who this program is available to. First and foremost, obviously, you must be a member of the chamber. In order to offer this level funded group health plan to your employees, there must be at least 3 individuals enrolled on the plan, 3 independent individuals. The rates, what we find in on a geographic location with chambers that we've been doing this throughout New England and Midwest and so forth, is that about 35 to 45% of chamber groups find a more competitive rate in this process than they have currently available to them. We have in this process as well, we have carriers that are involved in ensuring that the level funded plan is protected from any one individual large claim or from a number of large claims. The value in sharing this with you is that unlike going to one carrier, if you have a plan year where the utilization of your health benefits is high, obviously that will be reflected in its renewal. The value that the Middlesex Chamber program brings is for, depending on the size of the group, is although you may have had a high utilization year, on renewal, the incumbent carrier is going to want to raise those rates and capture some of the losses from the prior year. But we have multiple other markets that never had that experience. So that is what helps drive the consistency in the competitiveness in the renewal rates on these chamber programs than you typically would see in the fully insured markets. Networks. So most people think, well, I have Cigna, or I have Aetna, or I have Blue Cross Blue Shield, Connecticut, or so on and so forth. Those are insurance companies that negotiate with hospitals and health providers to provide a discount off of their normally billed charges. And the reason I share that with you is because we have Cigna and Aetna available to you. And both of those networks are Cigna and Aetna's national, most broadest and deepest discounted network. So that helps from a pricing perspective. And we also have a independent of carrier network called PHCS, which is available as well. The other thing we're going to want to talk about today and share with you as we go through a couple of these slides is prescription benefits. As I'm sure for those of you who have ever had to get a script, and if there's somebody out there that's never had a script, God bless you. It's certainly in the minority. A decade or 15 years ago, about 6 cents of every 6 cents of every dollar in premium that you paid as an employer in your health plan was for prescription drugs. Today, that number is nearly 40 cents out of that dollar. So we're going to talk about some of the risk management strategies that the chamber plan has available to it and is utilized to mitigate those costs. Not to eliminate scripts, but to get them at a far more agreeable price altogether. The other thing you'll find out with the Middlesex Chamber Plan is that unlike what you may have experienced in the past, these are true Erisa, Department of Labor, level self-funded health plans. Why I'm sharing that with you is because you as the plan sponsor, that's the name we use in our industry for the business owner, drive your health plan. You choose the plan that you want. And if you want to keep that plan year in and year out, that is your choice. The chamber will never come back to you on its renewal year program and say, okay, well, your rates are going up 8%, but we're also increasing your deductible, your copay, and your coinsurance. That does not happen in these. So it provides greater stability from a communications perspective, from maintaining benefits. We have had groups that have come to us and said, well, you know, this is what we have this year, but we really would like the plan that we had the prior year. It was a much better plan. That's fine. You drive that bus. The other reason why it's important to understand about this being an Erisa plan is because there are a number of benefits that are driven into both fully insured and some other plans that have to meet certain expectations, right? Whether it's the Affordable Care Act regulations or state mandated benefits that, no surprise to anyone, these tend to drive your premium costs up. As an Erisa plan, you as the plan sponsor / business owner are in that driver's seat. If there are certain specific benefits you wish to carve out that are extremely costly and would prohibit more of your employees from being able to afford, you certainly have that right to remove them. And then the last thing we're going to talk about, and you're going to see this in some of the following slides that we're going to go through here, is what happens when you as an employer have a really good year in your health plan. I have heard time and time again from insurance brokers and insurance consultants that one of the things that they tend to hear on renewal from their clients is that, boy, our group seemed to have been fairly healthy this past year. I didn't know of anybody going to the hospital. No one seems to have any serious health conditions, and yet we're getting an 18% increase. I don't understand it. We're going to talk about how this program really differentiates itself dramatically from that. And when you have a year or years in which you underutilize your health benefits, that money actually comes back to you as a business owner and to your employees and their dependents that are covered under the plan to be used in next year's premium and the meaningful effect that has year in and year out. So let's talk about what differentiates the Chamber's level funded plan from fully insured plans. And as you know, today, we use the acronym in our industry of BUCAs. That's Blues, United, Cignas, and Aetnas. Those are the 4 major health insurance providers in the United States. And then, of course, you have regional carriers. Here in Connecticut, we have Connecticut, we have Harvard Pilgrim, and so forth. But those are the majority of them. If you're an employer that's in the small group market, so that's 2 to 50 lives, the carriers file their plans and their rates with the Department of Insurance here in the state of Connecticut. Those are the choices that you have. You have to pick from them. You, as a plan, along with your insurance consultant and broker, decide what plans you're going to be offering to you and your employees. There is a rate associated with that plan. And they are what they're called age banded rates. So that means if you've got a 21-year-old employee, he or she is paying one rate for this, for let's say it's a $5,000 deductible plan, and your 51-year-old is paying a completely different rate. And that is what's provided out to you. The other component of this is, of course, you don't know what's going on from a year-to-year or month-to-month basis, I should say, on claims. You pay your premium. That's the end of it. Whether things go well or don't go well, that is the limit of your liability. So how does the Chamber's level self-funded plan look differently? Well, from a premium perspective or a cost perspective, you have more flexibility, as we talked about, in driving which plan you wish to offer and controlling that year in and year out. It's not going to change. You still pay the same fixed monthly premium for your employees. And that does not change throughout the plan year. Out of that premium, it gets broken out, and we're going to talk about that in the next couple of slides on how that gets broken out. And it pays your administrative costs, it pays your reinsurance costs, and it pays your claims. So it acts, looks, feels exactly like your fully insured plan, but there are a couple of key components to this. One is you're going to be your ability to receive monthly reports on where every dollar of your premium got spent. So you're going to know how much you spent in administrative costs. You're going to know how much you got spent in reinsurance costs, how much went to paying medical claims, prescription drug claims, how much your network access fees were. All of that are delineated out there very clearly, so you know what's being spent. What's the value behind that? Well, that tells you, and you can see very much documented in front of you, are you overutilizing your health benefits or are you underutilizing your health benefits? And if you're underutilizing, that means you've got money left in your account, and then you have a pretty good probability of getting that money back at the end of the year. The other component of that is whatever money remains in that account, it is the plan asset. So what I mean by that is, as the business owner, that's not your money to run off and go on vacation or buy equipment with, but it is your money and your employees' portion of their contributions money to be used for any health-related insurance in the following year. So that's whether you want to provide a premium holiday, you want to lower the employees' contributions, or you want to buy disability income or group life. That's certainly there, but that has to be used from a health benefit perspective. The last component of it is, and for many employers, they find this far more meaningful, or as meaningful, I should say, is that the rates are what they call composite rated. In other words, back to my $5,000 plan scenario, you have a 21-year-old that's paying one rate and a 51-year-old that's paying a completely different rate. Under these plans, they're exactly the same rate, irrespective of age. Why is that important? Well, because when it comes time to determining what the contribution level is that your employees are going to contribute to the health plan, it's a much easier component than trying to figure out, well, I've got somebody paying $350 a month and I've got somebody else paying $700 or $800 a month. Okay, moving on. So we talk about dollar goes out. How does that dollar get spent? Well, this slide here is going to share with you how it currently works for you today, both in the fully insured market with the Blues, the Uniteds, and so forth, as well as in the Chamber self-funded program. So the first box, medical and pharmacy claims. Out of every dollar that you send in, approximately 45 to 55 cents of that dollar goes into your claim bucket to pay claims. These are medical claims for doctor's visits, emergency rooms, so on and so forth, after the employee or plan participant has paid their deductible, their copay, and their co-insurance. Next, we move over into what are called administrative costs. These are the fixed costs that you would pay to the carrier to administer your plan. That's providing you with SBCs, your summaries of benefits and costs, your plan documents, your ID cards, your COBRA administration, all of that. That's about 20 to 25% of that dollar, as well as obviously all of your, in that administrative cost is whatever fees you're being paid to access your carrier, whether it's Cigna or Aetna or PHCS and so forth. The other remaining 20 to 25 cents is what we call medical stop loss or stop loss coverage. What does that mean? Well, if I have a condition 1 year where I have a significant health event where it's a $500,000 claim, you certainly don't want to be responsible for that as a business owner. That is capped. And you know exactly what your cap is. And once you reach that cap, and it varies from sizes of group. It could be anywhere from $7,500 to $25,000. It's what they call a specific deductible. No one employee can incur claims above that number that the plan is responsible for. Anything in excess of that is covered by the reinsurance carrier, the medical stop loss carrier. The same holds true for saying, okay, well, I'm paying $5,000 a month in total premiums for my employees at $60,000 a year. If all of my cumulative claims exceed that $60,000 number, that's covered as well. I don't have any more liability. So again, it's just like your fully insured plan works out today. The last box is what's called terminal reserve. Terminal reserve is important for claims that tend to fall behind or end up very late in the plan year. So let's presume for a moment that your plan year for your health benefit runs from January 1st to December 30th. And on New Year's Eve, someone has a heart attack and goes into the hospital. Well, if you didn't have terminal reserve, that claim may not show up for a week or two after. Well, you as the employer in a self-funded plan could be held responsible for paying that claim. So all of these plans have an extension on the back end to allow for those late year-end claims to come in and be covered under the contract. So you as the employer are not responsible for any of that. So that gives you a pretty good indication on the breakdown of where every dollar in medical healthcare costs. I hope you're all still awake and I haven't bored you to death in this process, but I think it's important in understanding where we're going next in this conversation and determining whether or not this is appropriate for you and your employer group. I want to just shift right back to that very first medical and pharmacy claim bucket, because at the very bottom there, you'll see where it says low utilization equals surplus, high utilization equals no additional cost to plan. So in that scenario that I used just recently, where you're paying $5,000 a month in premium, that's $60,000 for the year. Well, let's say you only use $35,000 of that. Well, that means whatever's the difference between that is the amount that you as the employer get back the following year to use to offset health coverage in the following year. In the fully insured world, it's called profit, right? In our world, for the chamber plan and its members that are on this program, it's your money coming back to you. More accurately, it's your money, it's your portion of the employer contribution plus the portion of the employee contribution coming back to be used for health benefits. So what I will share with you that probably will shock most of you is that nearly 70% of all US employees that receive their health plan through their employer receive it on a self-funded platform, not through the fully insured carriers. And so understand that prior to ACA, generally only very large employers would look at some form of self-funding. Now you have self-funding that breaks down into three components. Purely self-funded, those are for companies typically with 5,000 plus employees. Then you have what's called partially self-funded. That's typically in the past has been for employers with 200 to 500 employees. And then under that, groups did not typically self-fund. And now we have these level funded programs that are able to now provide the same value that larger employers only had in the past. Why is that? Why is this important? Because there's a reason why 70% of these companies are self-funding, because it's to their advantage. What I mean by that is that we know historically for the last 40 plus years, when we talk to all the actuaries and the underwriters in the industry, that employer groups have 2 years where they overutilize their health benefits. They have a lot of claims. And that means 3 years that they underutilize. So the value, as you can well imagine, is that you're going to have 3 good years versus 2 not as good years. That's the reason why these companies tend to level or self-fund, because it's to their advantage. It's a lower cost option historically over a 5, 10 plus year period. So now, is this right for you or not? In the prior slide, there was a bullet point in there that I'm not going to skip, which talks about individual medical underwriting. All of these plans are initially in the first year only, medically underwritten. What does that mean? Well, it's an application that those employees that wish to enroll are going to complete. Based on that information, the reinsurance markets or the medical stop loss carriers will determine what your rate for your group is going to be based on the information that has been gathered. After that point, that your group then becomes what's called experience rated. Why? Because you have, as the employer, the insurance company has, as the insurance company, all the detailed medical information that goes onward from that point forward. So they understand what that risk and the renewal should look like in the following year. So I always say that, well, I should say, I always used to say there are only two types of companies, those that are relatively healthy and those that are relatively unhealthy. I'm adding a third one to that. There are, in many instances, relatively healthy groups that may have a particular condition in a singular plan year that may not make this an affordable option for them. But the way this is determined is through that underwriting process. And the reason why 35 to 45% of the groups find that this is far more advantageous from a premium perspective for their health benefit offering is through that process, that we get to see really what are the conditions. You can well imagine, and I'll give you a prime example here, you have 5 employees on your health plan. I'm just going to use some round numbers here to make the math a little easier for me. Let's say your average premium is $600 for that employee, so you're paying $3,000 a month in premium. Keep in mind that $3,000, only $1,500 is going to pay claims. The other $1,500 is being utilized again in reinsurance premiums and administrative costs. Okay, so I have $1,500 a month or $18,000 a year that is going to be used to pay my claims after deductibles, coinsurance, and deductible coinsurance and copays, right? Well, I've got an employee that's on a $2,800 a month drug, and that is not uncommon. Well, if I'm funding $1,500 and I've already know I've got a cost of $2,800, this is probably not going to work for you, unless of course we have options, which we do through these programs, to significantly reduce the cost of that drug. Or you have someone that has an ongoing health condition that's going to be requiring a significant amount of medical expenditure. This may not be the right year, but it doesn't mean that the following year isn't. So as I shared early on in the presentation, we hear from our distribution channel partners, our insurance brokers and consultants that say, my employer's telling me, this group is particularly telling me that those folks are doing fine. They've been relatively healthy. I don't know why they're getting, an increase here. Probably a good fit for this. Then you're going to have those groups that are unaware of significant health concerns or significantly high prescription drug costs. That group may very well be better off. The key here is you don't know, because you're sitting in the blind if you're fully insured. And one of the things that I'm really honored to work with Kelly Smith and Darlene Kish, because they are truly agnostic when it comes to their approach, and certainly being on the Chamber's Insurance Committee, understand these components greatly. There is absolutely no cost for you as the employer to determine whether or not the Chamber Health Plan is a viable option for your employer group. It doesn't cost you anything. It'll cost you, well, I shouldn't say anything. It might cost you 15 or 20 minutes of your time to develop, to pull together the information that they need in order to run for that. And so with that, I'm going to turn it back to Johanna, and I believe Tom is next on doing some of our case studies and experiences.
Yes, thank you very much, Tony. A lot of information, but great information. Yes, I would love to introduce Tom Byrne. He's our current chairman of the Middlesex Chamber of Commerce, also president of Connecticut Rental Center. He actually did purchase this for his employees last year. We figured he'd be a great case study to tell you what his experiences are. So, Tom, you ready?
I'm ready.
All right.
Good afternoon, everyone. I'm happy to be with you all today to share some of my thoughts about the Chamber's level self-funded insurance program. Being on the Chamber board, I was able to see this program come to fruition, and I really couldn't wait to be a part of it. What's great about the program is how flexible it is for any business. I only have 12 full-time employees, and 6 of them are on the plan right now. As most of us know, the health insurance renewals have been increasing exponentially every year for me over the last 25 plus years. So the first noticeable difference between this plan and my renewal was the cost. Last year I had 5 employees on the plan, and with the chamber plan, I was able to save over $760 a month on my 2020 monthly cost, and over $1,200 per month on what my renewal would have been for 2021. I do have a couple of younger individuals on the plan, so their cost went up a bit because of the level plan, and some of the more senior employees came down a bit. So the cost is not based on age like most of the other plans are. That it worked for us. It was a good average. And I looked at the deductible, and the only way to afford health insurance on the regular market for me was to increase the deductible. And I was up to a $6,500 employee deductible for the individuals, and I was going to go up to $6,800 with my renewal. So I was starting to think, why even have insurance if it's going to cost you this much? The chamber plan came in at a $3,500 deductible, which was great for myself and my employees. There's also that reimbursement back for any of the unused money in the claims fund, which is a good incentive. So to me, it seemed like a no-brainer, and seems as we're going through this that it was a no-brainer to utilize the chamber program without the chamber benefits, the stability of the program, the cost savings, your deductible savings, and the possible reimbursements. It really adds up to be a winner. So that's my 2 cents, and I'll turn it back over to Johanna.
All right, thank you very much. So yep, Tom, we figured we'd choose Tom because he was kind of our experiment. He was one of our first to come on board, and we wanted you to hear from him, his experiences. So thank you very much, Tom. We truly appreciate it. Now I'm going to turn it over to Kelly Smith from NFP. She is actually our Healthcare Council chairperson, and also for years she was our chairman of our insurance committee. She's a great gal, and I'm ready to hear her give it a case study. Come on, Cal.
Thanks, Johanna, and thank you everybody for being here today. Great, there's my slide. We started this program, working on this program in 2019. So we rolled it out for the beginning of January 2020. Everybody knows what happened in March of last year, so everything was pretty much on standstill for quite a few months. But this company that I'm going to talk about, they ended up joining the chamber plan for March 1st of last year. So this is a local construction services company. They have 7 employees. They were with Anthem with a fully insured plan. They actually had a gold plan, which I'm sure most of you are familiar with the ACA metallic levels. A gold plan is a more expensive plan, lower deductible, lower out of pocket. So it was a very good plan. They were receiving a renewal of about 13%, which actually on the fully insured side is not all that bad. So what we did is we took a look at the chamber plan. We matched the gold plan as close as we could get it. And we went through the medical underwriting that Tony explained, and we were able to get comparable rates 16% lower than their current rates. So this was a great group. This plan was going to work wonderfully for them, as we had hoped. And I'm going to tell you what happened at renewal. But what had happened, the owner was interested in learning more about an HSA plan and how that could work for his employees. So we moved actually to a upfront $5,000 deductible HSA plan. It was a 35% savings, not just 16, 35%, with annual savings of just over $27,000. This was such a savings that the owner was able to put $1,500 into each employee's HSA account. So now what he did is he went with an alternative funding arrangement. And this worked great because he had a lot of younger employees that were very happy to get that money in their account, because if they weren't going to spend it, that money was just going to save and accumulate year over year for these employees. Also, with going with that upfront deductible, as you can imagine, it helps the claims fund, because the first $5,000 is going to be paid by either the HSA account, the $1,500 the employer put in, or the employee if it was over that. So this worked really well for them, and everybody was very happy with this plan. This plan actually just renewed for March 1st of this year. It actually came in at about a 6% increase. We were able to negotiate that down to basically a flat renewal. It was just under 1%. So there was basically barely an increase in premium, no plan change. They ended up at that point with just over $19,000 in their claims fund. So that's their surplus. So now we just have to get through that terminal reserve that Tony talked about, and we just have to reconcile at that point after all those claims are paid, and then they will get back money from their claims fund. So this was a perfect example that it was a company that this plan worked perfectly for, and they were extremely happy, and so were the employees. Again, we're giving you best case scenarios. There are times it doesn't work, as Tony said, 35 to 45%, but this was one of our first, and it worked really well. And the easiest renewal the employer said he's ever had. He didn't have any anxiety over knowing his renewal was coming up. And to Tom's point about flexibility, this employer has total flexibility in his plan and feels he has control over his medical costs and what he wants to do for his employees. So with that, I'm going to turn it back to Johanna.
All right, thank you, Kelly, very much. Next, we're going to hear from Darlene Kish from Hill Group. Darlene is our chairman of our insurance group. Darlene actually brought this program to us probably about 4 years ago, I would say, when we first started looking around, and we weren't quite ready to make the move. And then we really, really looked deeply into it in 2019. So I appreciate her steadfast commitment to having us look into this. So Darlene, you're up next.
Thank you so much. I guess probably the steadfastness is what keeps me at this table with everybody every year. I have a little bit of different experience. So my experience is just the insurance. Most of my clients are very long-term. I'm talking about 25, 30-year clients. So the case study that I decided to pick out was something that I had for many years. I'm going to say I've had this group for 10, 15 years, if not, it could be 20, I don't know. But for the last 10 or so years, we've had the benefits through Tony's plan. And because it's been so successful for this client and for almost every other client that I have, I kept saying to, as a person that through the chamber, I think it's important to bring it to our membership. I want to do well for the Middlesex Chamber. I want to bring wonderful services to the chamber. I want Middlesex to grow. So that is why we put together, or I encouraged to put together this kind of a plan for them. So this particular one is a local school system. I guess I could say who it is, but they've got 20 employees on the plan. They've been 10 years or so with this SO Health plans. Each year since we've had the plan, we've had little to no increase every year. Now, more important than that, and that's truly, truly important. I think it's really important to have no increase on probably the second largest expenditure of running a business. Now, I ran my own business for 25 years. This was such a point of contention, health insurance. You have to have it to remain credible. You have to, want to pull in the right employees. And then you look at the employees like, oh my gosh, this employee's young, this one's old. I'm going to be paying twice as much for this employee. In the back of your mind, you're not allowed to hire employees like that, but part of being an owner of a company, you're thinking about that. So here we have the same flat rates for everybody. There's been no increase. Not only that, and I think more importantly than that, we went for probably 10 years without any benefit change. No benefit change. So we had a $2,000 deductible for an individual. We had a $4,000 for family. Once they met the deductible, they paid 100%. There was no prescription carve outs. There was no anything. We had that until we chose to change it last year. So it was our choice that we changed the benefits. I felt like, and to Tom's point, I think he said there was a $6,500 deductible. The following year was going to be $6,800. Worse than that was the maximum out of pocket. The max out of pocket was probably $3,000 at one time. The next thing you know, it's $6,000, then it's $68,000, then it's now $8,000. The employee has to bring home $10,400 to reach that maximum out of pocket. Now we're in the middle of an international pandemic. What employee can afford an extra almost $11,000 out of their pocket? And that was for a good plan. So this gives us the opportunity to create our plan. So this is another reason why it's worked for us. So out of and this is again, a true story. Out of the last 5 years, we had 4 of them had a surplus of money in their account. Right now, it's almost $60,000 in their account. In addition to that, the employees got a premium holiday for the last 6 months, meaning they're supposed to be paying 33% of the premium. They didn't have to pay anything. The employees paid nothing out of their paychecks. Now imagine how excited the employees are of that. In addition, they ended up getting a new disability policy, meaning they had a short-term, now they've got a long-term disability policy too, because the employee benefits are getting paid with this extra money in the account. Now, every year, and I wouldn't be a good broker if I wasn't shopping the insurance around every year. So I didn't put the names of the carriers in there. However, if you look in the bottom of my chart, it shows that what each carrier cost. Now, I'm going to say carrier A. We'll just come up with the name of, could have been any one of the BUCAs, as Tony said, Blues, United, Cigna, Aetna, was 67.83% higher. What I didn't say in that chart is that the deductible was not $2,000, it was $3,500. It was $6,000 for their out of pocket for an individual. So the benefit was certainly not as good. So I told the client yesterday, I said, would you mind if I bring up, how wonderful, I don't even think they realize how wonderful their plan is, but the schools have different programs available to them. And it's never made sense. They have never, knock on wood, they've never left me, but they have never left this insurance package. There's no way they're going to find something that beats this. So even if, over 10 years, they've had a couple of bad years, it still completely has worked out for them. The other thing that I have to say from a business owner and from a broker, I have had groups, and I've got at least 200 groups. I've got groups that switch carriers every year. What a pain in the neck. You got to sit there, have each employee fill out all the paperwork. You as the employer have to fill out all the paper. Well, your broker has some of that information. It is not so easy to do. This, when we have moved over to this program, you've got one insurance carrier. And if this doesn't work, sometimes, let's say they did have a bad year. I just call Tony and Tony will say, we're going to just look at a different stop loss carrier. So if you go back to that first slide, and I'm not saying you have to, if we've got 20 A-rated companies, the employee doesn't even know you got a new stop loss carrier. The employee doesn't care. And so quite frankly, all those very detailed slides are wonderful to know that all that's there, but it's great to have the carrier stand by the product. So I just wanted to say I am extremely happy with this program. I'm extremely happy with the services that Tony and his team give us. And I'm so pleased and proud to be able to bring this to the chamber for their membership.
Fantastic. All right. So we're going to get right to questions since we're about 20 of 1. I do see some questions have come into the chat, so I'll go in there first. If you would like to do a question via chat, or you could always raise your hand and I will call on you. I'll be paying attention to that as well. So first question is, okay, I think this is going to be for Tony. We have several part-time seasonal employees in addition to 12 full-time employees. Under Erisa, must part-time employees be covered?
So that's a great question. It really comes down to what your employee handbook dictates. It's not us dictating. It's not so much Erisa, but what does your employee handbook say? Under the ACA, an employee that's working a minimum of 30 hours per week, or 1,500 and let me do my math here. Sorry, 1,560 hours a year are eligible for that benefit. So that is your low water mark, right? So whether they work that 1,560 hours in 6 months or in 12 months is not relevant. So it really is up to your, and I would leave this to Kelly and Darlene as well to address, but it really comes down to what do your employee handbook say and what are the requirements under federal law for offering it. If they're not working the 15, 60 in that 12-month period, you're not required to provide it. And and I may stand corrected, Kelly or Darlene.
You're right on, Tony. And it depends on the classification. If you're classifying them as part-time, then you don't have to cover them. So that's something that we go through when we get your initial, what we call a census with all your employee information. And we talk about how you're classifying your employees and who would be eligible.
All right, next question. Who is the risk holder if there is an overage rather than a surplus at the end of the year? Who pays those claims? Is this where the stop loss kicks in?
Absolutely correct. Yes. So those, when we talked about in that earlier slide, we have in the small group market, so it really truly small group. So for us, 3 lives to 24 lives, there are 3 A-rated carriers that compete for your business, that we make compete for your business. Once we get to 25 and above, there are additional 17, 18 A-rated carriers, but they're all A-rated. I can certainly give you the names of them. You probably wouldn't know them other than Lloyd's of London, which is in the mix, but typically they don't get involved in groups well below 150 to 200 lives, but they're all A-rated and they are covering the group on 2 levels. One is in case a single employee or their dependent has a significant claim, you're covered under that. Once it gets over that level, we talked about 7,500 or 10,000 or 15,000 is typically what we see as a specific deductible for an individual. And then you know what your aggregated amount is because that's your 12 months in total. Everything that goes 1 penny above that amount is covered by that same carrier. And so there's no additional liability to you as the employer or your employees.
Great, thank you, Tony. Next question. We have a 30-day probationary period for new hires. Can we wait 30 days before bringing the new employee onto the plan?
Kelly, Darlene, I believe the answer to that is yes.
I'll answer that.
30
Yeah,
days.
sure. Yeah, as
Yep.
long as the employee doesn't wait more than 90 days, you're all set. So you can do first of the month following, 60 days or, whatever you choose to do.
Right.
All right,
Yeah,
thanks.
under the ACA, I believe you cannot go beyond 90 days.
Great. All right, next question. Who holds the premiums that the employer and employee are contributing? Are the funds held by an insurance carrier that handles administrative services only for the plan?
That's a great question. So unlike ASO, so ASO is the acronym in the industry that's called Administrative Services Only. You have a 500 or 1,000 life employer group that goes to Cigna and says, listen, we're going to self-fund our plan, but we want you to administer all the claims, right? We will pay those claims when they come in. You just tell us how much we have to send you and you do that. The other way, the way we have found in over 30 years of doing this, it seems to be more competitive in far more instances, is to use a third-party administrator. Because this is a true Erisa program, the administrator receives your check as the employer and deposits it into a custodial account that you own as the employer. That's where your money goes. The third-party administrator has a fiduciary responsibility to pay all expenses out of that account and provide you detailed reporting on a month-to-month basis. So they pay Cigna their network. They pay CVS Caremark what they want for prescription benefit network access. They pay the reinsurance carriers to cover you on any individual claim or aggregate claims or total claims. And then they pay claims out of that as well. That account is established in the business name. It is owned by the business, but administered by a third-party administrator.
All right, thank you, Tony. This is something that popped up and we actually talked about in our pre-planning of this meeting. What does Erisa stand for?
Employee Retirement Income Security Act. So this goes back to the 60s where Erisa really was established to protect pensions. Self-funded health plans that came along later after were rolled under that. And actually Erisa is a subset of DOL, Department of Labor. But Erisa has its own subdivision called EBSA, Employees Security Benefit Administration, that actually has the oversight over the self-funded health plans. Be careful what you ask for. I might just tell you. Sorry.
I told him we're going to have that question. So thank you, Dick, for asking that question. Can I join anytime or just at my renewal?
Oh, what a wonderful question, and thank you. So when you're in a fully insured arrangement, right? You're with Cigna or Aetna or Connecticut or so forth. You're on what's called a month-to-month contract. So we have had employer groups that say, hey, listen, I would like Kelly, Darlene to do an audit of my current health plan and tell me, am I going to see what Tom saw in his plan, right? If I'm going to see savings. But here I am already 4 months into my year. That's great, because here's how the chamber program actually adds additional benefits. Any employee who's already had a certain amount of money attributed or applied to their deductible will be credited even though you're moving off your calendar year. So I have a $5,000 deductible plan. I've already spent $3,000 in claims, and that I started in January 1. I want to move in June 1. Those $3,000 are credited. You as the employee now only have $2,000 left for your deductible for the next 12 months. So you actually got an extension on that.
Great. Thanks, Tony. All right. Question. I am up against the July 1st renewal. Is this enough time for you to underwrite my employees?
It is. And another great question. So the underwriting process really only takes about 48 hours. What takes a little bit more time, we typically see in the non-fourth quarter season when things get crazy, but typically our stop loss carriers are back to us in 5 to 7 days with their initial proposals. If those numbers look competitive, then we go through the underwriting process for groups of 10 and above. For groups under 10, you have to submit the health questionnaires, and Darlene and Kelly all have access to that as you do, Johanna, to get that to you. So 5 to 7 days to get the initial rate, and then 48 hours after that to underwrite it.
All right.
Tony, can I add to that?
Sure.
Because it is about what's easy for the client too. I just want to share with you, those applications that the employees fill out are their actual enrollment forms too. So you're not going back to them asking for more forms to complete. So again, keeping it simple, keeping it easy. It really truly doesn't get easier than that.
Good point,
Good
Darlene.
add-in. Good add-in, Darlene. Next question. Is there an annual Erisa filing for the plan? If yes, who is responsible for the filing?
Yeah, so there is a requirement of a 5,500 filing, but I believe it only is attributable to groups of a specific size, which is much larger than what we're talking about here. And then as I understand it from EBSA and Erisa, that maybe 20% of businesses actually do that filing. And then the last I heard, there was no Erisa police out there patrolling this.
Erisa police. That's new. All right. I'm gonna let you guys answer this, even though I think I know the answer. We have 3 employees, but one is on her husband's plan, so would not be able to use this plan. Does the 3 employee threshold have to be in the plan?
Unfortunately, yes. And it's not our dictate, and it's not the chamber's dictate. It's the reinsurance. As you can imagine, to administer a 3 life group generates X number of dollars. To administer a 300 life group generates considerably more money. So from a third-party administrator and what the fees that they get for all the work that they have to do, for the risk that the insurance company has to take and the premium that it needs to collect to take that risk, 3 is the absolute minimum.
Okay, there is another question here, and it says, is this, I think, available?
That was me. That was a mistake. I'm sorry.
No worries. I was going to unmute you, so that's perfect. Thank you. Okay, is there any more questions at this time? You can put it in the chat, or if you want to raise your hand, I can call on you. All right, we've got another one. All right. I may just be naive, but 1, does this encourage employers to discourage their employees from using healthcare? And 2, are there privacy issues regarding employers seeing how much and what kind of healthcare their employees use? Okay,
so let me answer the second question first, because I'm not sure I understood the first question. I'll ask for a clarification. From a HIPAA perspective, no, absolutely not. All of this information is absolutely HIPAA protected. The employer Now, I will throw this curveball. If the employer identifies a key employee or themselves as the privacy officer for their health plan, which under Erisa they can do, their fiduciary, they do have the right to see every individual's claim and everything else that's associated with it. What I will share with you is, in reality, is I don't know of any one of our groups that position has ever been taken. They all want their report sent, but don't tell me who it's for. The condition, fine, the cost, fine. I get that because I need to be able to track this, but I don't want to know which employee. So if I could have a clarification to the first question, that would be helpful.
All right. The question is, does this encourage employers to discourage their employees from using healthcare? So because you want to maintain a lower rate, they're saying, is that in essence asking your employees not to utilize the healthcare as they would if they were on a regular fully funded?
Yeah, no, I don't see how it would be. Yes, you would, obviously we have the vast majority of our groups that see surpluses at the end of the year, but that is certainly not because there are any barriers put to quality care for those employees. There's no one gatekeeping that option out there. What we are doing is providing education and resources for employees that say, hey, listen, I need a hip surgery. Well, you know what? You can go to hospital A for $15,000, or you can go to hospital B for $30,000. We're not telling you which one to choose, but know that that's what it is. And they're both qualified hospitals that have great accreditation and so forth. So you've got a high deductible plan. Which one would you rather have? You've got co-insurance and out of pocket, where it's the best fit for you. So there's nothing from the standpoint of gatekeeping that's going on at all.
If I could add to that, Dick, I've had groups that say, you know what, you're giving me way too much information. They don't have to look at it, but they said, I don't want to know what my employees did over the weekend and what kind of prescriptions they're on. So we did pull back the reins, and if they want it, we've got all the information that they might need to make it really good healthcare decisions. But if the employer doesn't want that information, there's nothing to say that you have to take it. So right. We can pull back on that.
And I was just going to add the same thing. Even with the health statements, we tell the employees can send them directly to us. They can put them in sealed envelopes. We keep that as private as possible. And also same thing, a lot of my groups, the employer just wants the aggregate report, which shows total claims, does not want all the details. And that's totally up to you.
All right, thanks, guys. Great answers. Dick, if you have any more questions, please continue to ask while we're here. That's what we're here for. Next question. Is there a wellness component in your plans to drive healthy lifestyles? Great question.
Absolutely, there is. So the one thing that is embedded in the chamber program is as part of a wellness component, if you will, and there are multiple ones, but the one that seems to really stick out in my mind is gym reimbursement. So we reimburse the plan participant, so the employee, $200 every 6 months through their plan for gym reimbursement, and $100 every 6 months for their spouse. And there is a simple form that they take along with them, and they have it signed. And as long as they're going, I believe it's 60 times in a 3-month period. It's not an owner's thing. You don't have to be a gym rat, right? But you got to show that you're at least getting out there. There is a component with some of our reinsurance carriers that have a wellness benefit called Vitality, which provides for biometric screenings and things of that nature, health consulting and wellness consulting. So yes, there are components in that. And it's not just what we bring to the table through the chamber plan, but your insurance consultant, that's Kelly and Darlene, have access to numerous vendors that can also implement us in this as well.
Hey, Tony, can you add the part about, which I just absolutely love, and we've been using it for years, but it's never been more prominent right now than through this pandemic, is the online doctors. Now, probably everybody on this call is now familiar, but if you could just expand on that a little bit, I think that was really what turned me, and we got posters on it. We've got little cards for their wallets. We've got little things for their telephones, whatever they want on that part of it.
Yeah, so we have very dedicated, thank you, Darlene, for sharing that, because I mean, we could literally do hours of this, folks, on all the different components that we can embed into
Sorry.
this. But we certainly have telemedicine embedded, but equally as important is in many of these cases in the plan document, right? So the plan document is basically everything that how things are supposed to get done through the entire plan year. This is what you as the plan sponsor employer sign off on that says to the third party administrator, these are the claims you get to pay. These are the claims that don't get paid. And when I say you're not dictating what doesn't get paid, but the exclusions obviously that are already contractually obligated by you. And I want this included, or I want this excluded. And one of those things is telemedicine. So we have ways of in the plan document saying, okay, I've got a $3,500 deductible plan and I've got a $50,000. I have a $50 copay for a primary care visit. If I pick up the phone and call this telemedicine vendor that's part of my plan, and if that doctor, and these are emergency room board certified doctors that not only answer the phone, but actually own the practice, if they must refer these individuals onto a brick and mortar setting, so they've got to go to a doctor's office or a specialist or urgent care or emergency room, the individual does not have to pay that copay. Why is this important? Well, because 85% of the calls that come into the telemedicine service through our service are answered right there. They don't have to go any further, and less than 3% actually go on to an emergency room. So understand the dynamics and the importance of this, not only convenience for the employee and the plan sponsor, because when do kids get runny noses? It's never at 10:30 in the morning. It's at 10:30 at night. The doctor's not there. So now I'm got to find an urgent care center that I can go to, an emergency room that I have to go to. And guess what? My cost is personally out of pocket is much higher. And certainly to you as a plan sponsor is going to be significantly higher. There is no charge for the call to call these telemed services. There's a $75 charge that gets charged to the claim fund as the plan, but the participant doesn't. Why? Okay, so you're saying, okay, well, I just got charged $75. Well, keep in mind that an office visit can easily run $200 to $500, urgent care $300 to $500, and emergency rooms $1,000 to $2,000 to $3,000. Would you want $1,000, $2,000, $3,000 taken out of your surplus or 75? So it makes the math much easier, particularly if you're addressing 85% of these calls on the phone. And not only do they order prescription drugs, they can do MRIs, CAT scan orderings, a whole myriad of services that can be provided. Sorry,
Right.
I get
Tony gets very
animated, but I
excited.
love
He
this
gets
stuff.
very
Yeah, it's
excited
great.
into this topic. See the passion. There has been several requests about, we will be sending this presentation to you after. So watch your email for that. Something I just wanted to make everyone aware of, it was really important when we put this product together that, we were trying to bring something that was very affordable to an option that was available to all of our small members. So, please check this out. For more information, I could set up a meeting with you and Kelly or you and Darlene. Shoot me an email at johanna@middlesexchamber.com. That's JOHANNA@middlesexchamber.com. And they can really go into the nitty gritty because really, truly, we could probably be here for the next 4 hours, but we always like to start on time and end on time. And we're a minute shy from 1 o'clock. So I do appreciate everyone's time. Thank you for coming. Thank you for asking great questions. It really made for a really good discussion. So we appreciate it. If you want more information, shoot me an email. There's no obligation to you, but just find out what it's about. There's a lot of great options for you, and we're certainly trying to be in your corner to help you save some money. So thank you again. Be safe. Enjoy the thunderstorms later. I guess they're going to be pretty bad. So thank you again. Have a great day. Be safe and healthy, everybody. Thank you.
Thanks, everyone.
The sun is shining, Johanna, here.
Not for long.